in the heart of Yorkshire. Our health service is hard at work.
Barnsley A&E.
They'll be here in a minute.
A dedicated team working around the clock in Casualty.
Just waiting for that bed to be ready. Push, push, push. I've got ambulance crews all the way up that corridor.
They're with us for our most vulnerable moments.
Don't get upset, you'll get worse.
God almighty.
Sorry.
Facing life and death. Trauma and tears.
You've broken that arm quite badly.
Supporting each other through the toughest shifts.
They need a medal in there.
Come on.
I feel like her off a Titanic.
This is Barnsley Casualty 24/7.
I cannot believe that.
1, 2, 3. I'll get the biscuits out later on.
I love you.
I love you.
On shift tonight,
Just get on with it.
advanced nurse practitioner Cheryl Barnes,
Come on, don't get upset, you'll get worse.
Don't cry.
registrar Dr Ashley Trimble,
I'm just going to take some bloods, if that's all right.
I've got some left, you can have.
Yeah.
I don't like these.
Sister Jane Hawksworth,
They're my favourite.
and nurse Kate Ellis.
I'm scared.
So get ready to share a shift with the team at Barnsley Casualty.
Forgot me teeth.
Let's have a look.
A dedicated team of 36 doctors and nurses is starting a new shift at Barnsley Casualty.
Lovely, thanks, darling. Bye. Abby, bed's ready for your lady.
Over 300 patients will come through the doors today, and it's down to Sister Jane to make sure they're all seen in good time.
You are?
No, they need a medal in there.
Come on.
I actually do. Hug therapy. Everybody loves one of my hugs. And you're very special if you get one.
Okay, morning, everybody.
In the Casualty Hub, Sister Jane has just had a handover from the night shift.
There's currently 28 patients in the department, 1 in resus, 4 in peds, just 2 patients waiting to be triaged in the hub at the minute, 17 patients waiting to be seen by the doctor with approximately an hour doctor wait. And that's pretty much it from me at the moment.
Thank you very much.
Patient flow within the department's really important. If we can't move the patients out of the department to wards or home, we become blocked.
And a bed in resus is about to be needed for a critical case.
How long will you be, do you think?
A 59-year-old woman is struggling to breathe.
See you in recess then. Bye-bye.
The paramedics have briefed Nurse Cheryl about the patient.
So 3-day history of worsening chest symptoms. She's tripoding, she's holding herself like this, because her breathing's so bad. When that red phone rings, it gives you a bit of an adrenaline rush. I don't think that's a bad thing. It just makes your mind really switch on to what you're going to do.
What's this lady's name?
Adele.
Adele? I'm Cheryl, I'm going to be looking after you, okay?
Take that off. Get your arms into the bed.
We'll sort you out, sweetheart. You just relax, okay?
I can't relax.
I know you can.
I know.
Yeah.
1, 2, 3.
There you are, Adele.
Oh, my.
Just sit you up.
Yeah.
Lovely. So what's been happening, Adele?
Must be breathing.
Yeah?
Thought it was panic attack.
Yeah, well, it makes you feel that way, doesn't it?
Yeah.
Yeah. Okay, no problem. I'm going to get a full set of observations on you, okay?
Yeah.
When you see somebody that's short of breath, there's a bit of panic there, and that can go downhill really quickly. That's quite scary to treat, and I still find that a little bit daunting. All right, we've got a line in, haven't we? Let's get some 12 lead, let's get some bloods. Just take your time, I'll do an ABG as well.
Paramedic Michaela hands over.
Hurry on amoxicillin, finishes course tomorrow. Gave her a Ventolin because they thought that she might be starting with something, but not really any lung condition at all. You didn't like to bother us, did you, Adele?
I didn't know, Wolf.
You've had a bit of a time then, love, haven't you?
I have, Wolf. Michaela says I should have phoned earlier.
You probably should, but if you think you're panicking, you don't, do you?
No, no.
All right, I'm just going to do a blood gas, all right, in your wrist.
Nurse Cheryl takes arterial blood to see if Adele's vital organs are getting enough oxygen.
We'll get all this breathing sorted for you,
thank God for that. Driving me nuts.
Bless you.
Oh.
Right, this is a bit sharp in your wrist, all right?
Yeah,
All right, just keep
whatever.
nice and still for me. It's all right.
Oh.
It's all right, you're doing brilliant.
Yeah. Just get on with it.
We've got it now, nice and still. Well done.
Adele's been struggling to breathe for over 9 hours.
God almighty.
Nurse Cheryl needs to find out the cause of the problem quickly. In Barnsley Casualty, Sister Jane has more patients than beds and not enough nurses.
Yeah, I'm too qualified down all day. I mean, obviously, Vicky keeps walking around saying it's the quality that you've got because she's here. And you give such a lot, Vic. I know.
But Sister Jane has been able to find a bed for a new patient, being looked after by Nurse Sophia Egan.
I don't like hospitals. Never had them.
Why?
I used to clean them.
How did you?
Margaret thinks she's got a urine infection.
Right, this is Margaret, 2-year-old. She started this morning with symptoms of burning sensation and urination. And she's needing to go very, very frequently. She's managed to serve as a sample in a jam jar. It's
A marmalade jar, a marmalade.
managed to serve as some, and it's very dark and very bloody in nature. She talks a lot.
I talk a lot, love, because I'm on my own. So what's gone off in my life, I've got to tell somebody. Enter.
Yeah. So we've got the burning sensation. We've got the usual sort of markers.
Are you allergic to anything?
Aye, men.
Thank you.
Well, you get 3 men and they're all dead.
They might be allergic to you.
I'm too energetic.
Way too energetic. And tactile.
Any more past medical issue? Angina, stent?
Arthritis, we've got an aneurysm, spondylitis. And
I've got
a heart
any-
attack. And we have had previous UTIs. Got a headache now. I've got a headache now. You're not running a temperature.
It's hot.
Thanks, sweetheart.
As well as running the shift, Sister Jane also takes on patients when nurses are stretched.
Are you on blood thinners?
Yeah,
What do you-
I saw by
Mononitrate. Margaret, you're a right busy bee, aren't you? When we're doing these bloods.
You've had 3 lots.
Well, we're having a fourth.
Oh shit.
We're gonna sell it on black market.
It must be good. It must be good.
It must be a bit of good stuff, eh?
Let's have a look what you're on. They're your isosorbides for your heart.
Yeah.
A tenolol for your blood pressure.
Right, lovely.
There's all
There
sorts.
you go. Okay, you put some pressure on there.
A statin, aspirin, and a meprazole for your gastric. Do you get reflux?
I've
All
been
right.
in the water belching.
Okay, let's pop all these away.
Covered my body up.
Margaret was rushed into Casualty quicker than she expected.
And I forgot my frigging teeth. Again.
Your teeth. Let's have a look. Oh yeah. So not answering 1369.
In the hub, Sister Jane continues to work on transferring her most poorly patients onto the wards.
Do you want to ask her to pull the bed now so that I can get her back off straight away? Yeah. All right, thank you, bye.
Sister Jane might need to request a bed on intensive care for 59-year-old Adele. Nurse Cheryl is still struggling to stabilise her breathing in resus.
Can you get me another gas needle, please? It's really massively important for us to keep calm. Now, inside we might not be calm, but on the external, we need to be calm. What I want you to do now, look at me, Adele. Sit back.
Yeah.
Right. I always think about that swan, you know, looks really elegant on the lake, swimming very elegantly, but underneath the legs are going like lightning. And sometimes we're like that. Right, okay, you're safe now, okay? I know it will be with the breathing.
Yeah.
All right.
Yeah.
All right. Nice and relaxed for me now. Some nice long breaths.
It's all right, you say
I
that.
know it is, I know it is.
Doing it all day.
I know. Listen.
Yeah.
Just calm your breathing a bit.
I know.
Paramedic Michaela brought Adele in.
You're not going yet, are you, Michaela?
I will be in a minute.
All right.
Oh.
I know.
As much as I'd love to stay with you for a day.
You've got me now. I'm going to look after you.
She's been home with me now.
Hold
you go.
Come on, don't get upset, you'll get worse.
Don't cry.
I know.
Sometimes when the patients come into resus, they've already formed that really good bond with that paramedic. And so that's massively important to make sure that the patient's aware that they've got to go, but that you're there for them now and that you're going to take over and you're going to look after them.
Adele has been given steroids and a nebulizer to try to improve her lung function.
Okay, so you've got widespread wheezing across your chest, all right? That's your upper airways, so we're giving you the right things. We just need to get the gas that we've done. And we'll get you some blood soft now. It's all right, you don't have to be sorry, sweetheart.
Adele's medical history gives cause for concern.
I had pneumonia when I was about 19.
Right.
I had that bad.
Yeah. We need to make sure you haven't got that again.
Adele needs an X-ray on her lungs, but she's too poorly to move. The machine must come to her.
It'll soon be done.
In the hub, Sister Jane's still struggling to free up cubicles.
Hi, it's Jane. It's really all a big balancing act. It's like spinning plates and then running round to the first one again before it falls off. Will you just tell Ainsley that I'm going to have to send that man round in about 15 minutes or so? It can be a really hard job and quite stressful. Oh, lovely, thank you. Cheers, bye.
Barnsley Casualty has 4 paediatric cubicles, and as usual, they're all full. Nurse Kate is looking after 2-year-old Era.
So she was downstairs when she was sick. Yeah. When she'd been sick, I took her upstairs.
Can I have a look in your eyes?
Era was rushed in by ambulance with her mum, Storm, because she's been having fits.
Good girl. Can I put this on your arm and squeeze them muscles?
Era's clothes have been removed to cool her down. Her fitting might be caused by a high temperature.
She was being sick, and as I was trying to undress her, she was just like going floppy. And I was rolling back.
Okay. And then when did she do the shaking thing? That's all the time.
Era's blood sugar was very low when she arrived. To raise it, she was given jelly to eat.
Did it taste nice? Yeah, you're saying yeah, but Mum says no. Let's borrow them toes. Give them a clean. Oh, dropped it. And are we ready? 1, 2, 3. Well done. No, it's got even lower, unfortunately.
Low blood sugar can cause seizures and brain damage. Era's given a glucose injection.
Oh, they've got a blue bus. That little boy saying, "Where is my teddy bear?"
Play leader Lindsay Holmes and Era's sister Evan team up to distract her.
Oh no, what's happened to our bubbles?
It's all done, you're so brave.
Hi, I've got toast.
Oh,
right.
Look what we've got.
And then this one's yours. I've not put any jam on, I've brought it all around so you can decide what flavour you want, okay? Have some jam. Look, dip. Hello, I brought them a packet each.
Lovely. You're gonna have some biscuits. Good girl.
Sister Jane's blood sugar is also running low.
I don't like these. you want a licorice?
Where's the bubbly ones?
I've just had one because that's all I eat.
Luckily, Sister Vicky is coming up for a break.
Hey, there's some money, we could go to the shop. £3, £4, £5. You want to go to the shop for some savoury stuff? Get some crisps. There's £6 there, I'll give you some money.
Thanks. We get to keep change.
Yeah.
I love a good Ferrero.
It's 1 p.m, and with the waiting room full and casualty beds scarce, Sister Jane's doing everything she can to free up cubicles.
Hey-o.
Hey-o.
A new message. I don't know it's the frigging press.
It's very important to find time to chat to a patient. How many times have you been married?
3.
I think that is part and parcel to their feeling better and getting well.
Margaret came in with a suspected urine infection. Junior Dr. Sarah Brown has her blood results.
Right then, we're happy that we can get you back home. So I've prescribed you some antibiotics for your water infection to take when you're at home, okay?
I bet to look what time it is.
Yeah.
I've
You've been here a while, that's why. All right, let me go and sort those antibiotics out for you.
With the infection identified and the antibiotics prescribed, Margaret's off home.
You've had a cracking life, you. We all men you've had.
Tough and useless,
Right. Look after yourself. What, are they sending you home with some antibiotics?
Yeah, give me a little box.
You will always click with some people. Shall I walk you outside? Come on then. I can't say it's sad to see them go. They've come into hospital, they've been scared, they've made you laugh. Hey up, love. She kept us entertained. They've been seen, treated, and they're on the way home, and it's nice. See you, Margaret.
Back in Rhesus, Adele is still struggling to breathe. Nurse Cheryl has arranged an X-ray to check for pneumonia.
Shout you to breathe in and hold your breath.
Don't make me laugh. What, no, breathe in and hold it?
I'll tell you where. Don't worry. And breathe normally.
Put your left side. That's a rib into it.
Yeah, I'm fine with that. That looks all right?
Does it?
Yeah.
Bloody hell.
Let's take this mask off now and see where we're at. Nice breathing for me now.
I'll try.
I know.
But I've been doing that breathing all night.
Yeah, you get into a routine then, don't you?
Yeah.
There may be no sign of pneumonia, but there is an infection, which needs treating urgently.
So this is your antibiotic, because we've seen that little bit of infection on the bottom of the right lung. We think anyway we have. We'll see what the report says. It's not massive, but it's certainly there.
No, well, that's it, isn't it, love?
Yeah, that's it, love. Yeah, this will help. Let's get that back on board, because you were doing really well.
Yeah, love.
All right, so that's the antibiotics in your bloodstream, so that's sorted.
Cheers, I love.
Adele's daughter Katie has just found out what's happened.
Here she is. She's loads better than she was.
What are you doing?
I know.
On the bottom of your mum's right lung, there's a little tiny bit of infection there, but that can account for a lot of the shortness of breath she's had. Okay.
And panic attack.
Yes, definitely that. Well, there is an element of that, definitely.
Yeah.
But your chest was extremely wheezy, and that's why the salbutamol worked, because it helps the wheeziness.
Yeah. I thought I was going to die. Scary. Or pass out and knock back up.
Adele's son Michael arrives.
Oh, I am here.
Katie recently got married, and she hopes looking at the photos together will help calm her mum.
That's not a dress, obviously. That's a nice one.
Just breathe and sure. So I got your bloods back, and they're not bad at all, right?
Okay.
So I don't think it's a massive infection, this.
Good, love.
But we've covered it anyway, haven't we? We're
Yeah,
giving
we
you some antibiotics, so that's fine. But you're still requiring oxygen,
Aye.
so that brings you into hospital. Okay. Other than that, you're doing fine.
Good. So, there's no untowards then, love?
No, nothing I can see.
Yeah, all right.
Yeah. So what will happen to me now then?
You go up to the ward and they'll watch you for a while and try and get you off oxygen and then decide what's going on then. Okay.
Oh, yeah.
On the ward, Adele's breathing improved further. She was well enough to go home the next day.
Hey up, it's only me. I've got one from Resus up to AMU, love.
In the hub, Sister Vicky has returned with some treats.
I've only bought 2 things for some change.
What have you bought? Cheese puffs? Hello. I've discussed it with Fiona, the bed manager, who's discussed it with the gynae SHO, and they've said that she's all right for GAC. Thank you, bye.
With cubicles still scarce, trainee advanced nurse practitioner Chantel Proctor is alerted to a new arrival.
A sudden onset of headache and stiffness in his neck. Let's have a look.
But with patients stacked up in the corridors, finding them can be difficult.
When the department is so full, trying to find your patient, it's like finding a needle in a haystack. What name is it? Ah, you're mine, but I need to find you a cubicle. Bear with me. All right. Sometimes you might hear a little voice saying, I'm here, I'm here. So that's how you find your patient, basically. That chap on corridor F, if you'll get him, can I bring this out, yeah?
43-year-old Ian has had a bad migraine for 3 weeks.
Just put lights on. Turn down. That all right? Yeah.
Ian's girlfriend, Colleen, persuaded him to come to Casualty.
Men don't seem to come to A&E. Right, tell me what's been going on.
Raging headache, stiff neck, real bad hot and cold shivers.
Women are here all the time, but men do not come to the GP, men do not go to A&E. Did it come on gradual?
No, straight hit me out of nowhere.
Okay. And where did you feel it in your head?
All over.
All over, right, okay. What were your next symptoms?
My neck, real bad stiffness, and then hot and cold. And for about an hour I was physically shivering, and then I was red hot to touch.
Okay. Any episodes of memory loss?
No.
No? No behaviour change?
Just pattern, obviously being very lethargic.
Yeah.
And when he says he's shivering,
He is really shivering.
And he is burning hot.
Okay, you've been sweating as well?
Yes.
This pain in your head, can you describe it?
It's like my head's in a vice and it's just getting turned.
Like a pressure?
Yeah.
Okay, so what other past medical history have you got?
I've had meningitis, I've had sepsis 3 times. The latest one was last June.
Ian's severe migraine could indicate a recurrence of the meningitis or sepsis, or be caused by a bleed on the brain.
Look up.
That's as much as you get.
Okay, and look down. Is that due to pain or just because it'll not go?
No, that is due to pain and the stiffness.
Okay, that's fine. And if I touch down your neck?
That hurts.
It's painful?
Yeah.
Okay. Is it painful when I touch your head?
Yeah.
What does it feel like when I touch your head?
Like somebody's pressing it really tightly.
Okay. At the front here?
All over.
Okay, that's fine. And just sit back for me. You alright?
Oh.
Okay. I've got a feeling you'll be staying in.
I've got a feeling that.
Alright.
Ian will have bloods taken to test for meningitis and sepsis. But first, an urgent CT scan is needed to check for a bleed on his brain. Halfway through the shift at Barnsley Casualty. Already, over 150 patients have come through the doors.
Okay, so good afternoon.
Sister Jane gathers the team for a briefing. All 30 treatment cubicles are full.
So there's currently 58 patients in the department with about an hour and a half doctor wait. Just be mindful that we are a bit short-staffed. Currently, really no beds in the hospital. We're really struggling surgically wise, and medicine is very tight. So if you do have a patient that you're referring, if you just refer them as soon as you can. Thank you.
Okay.
She'll just have to wait 2 minutes because my nurses are up transferring our patients out as well. So just bear with me, I'll take you.
Thankfully, a bed in resus has just come free because a patient is being rushed in with a horrific ankle fracture. 84-year-old Terry fell in his kitchen and his wife Lydia called 999.
So what happened?
Dr. Trimble will be treating him.
I just started to move away from the sink.
Mhm.
With my left foot. It just gave way.
Wasn't like you slipped in anything.
I just went down and heard the crack.
Okay. I'm just gonna have a chat with my boss and we'll get this so it looks a bit better. Alright?
Yep.
Won't be long.
Consultant Dr. Dave Walker and Dr. Trimble need to straighten, then set the bone.
Get over here on the foot. You just
And turn it the same way.
yeah, just all true. In a minute, we're going to straighten this. I'll not lie to you. It will hurt a bit. So if you take that, that will help a great deal.
Just gonna hold it.
It's very floppy.
We straightened it now.
Yeah, it's just quite unstable.
Oh yeah, no, it's very lovely.
Because every time slightest movement, it's just clicking.
We need to put a plaster on because it won't stay like that if we let go.
Sister Vicky breaks some bad news to Terry.
We might have to cut your joggers off.
Yeah.
The Sheffield Wednesday ones as well, I know. Are you okay for me to cut them off?
Yeah. I'm going to have to get a new pair.
I think you deserve a new pair after this.
Ashley will buy you some.
Terry's ankle is tightly secured with bandages and a temporary cast, while doctors investigate whether he needs surgery.
You okay? That's as bad as it gets.
Well done.
Okay.
Terence, what did you used to do as a job?
Musician.
Musician?
I worked all over the world. Played for Engelbert Humperdinck,
Oh, yeah.
Jim Mansfield, the film star.
Lydia and Terry have been married nearly 40 years and travelled the world together.
We call it maestro. No, how do you say it?
Maestro.
Maestro.
Dr. Trimble orders an X-ray to find out the severity of Terry's fracture. He may require an operation to fix his ankle in place. It's 3 p.m, and with the waiting room full, Sister Jane still doesn't have any free cubicles.
My other lady can come out. What other lady? I've got two ladies in there. One of them can come out and I'll take the other one out. She needs a right, where does she need to go? I am ill. But you're my favourite. I'm out.
Over in the paediatric area, junior doctor John Shepherd investigates the cause of 2-year-old Era's low blood sugar.
Diabetes does run in my family.
Okay. Who has diabetes in your
My granddad was a diabetic, and then my mom passed away 2 years ago from a diabetic coma.
Okay. It sounds like you're thinking along the lines of whether or not diabetes is what we need to think about. Type 1 diabetes is what I would sort of think about in someone this age, but I think your grandparents would have known about that from a slightly earlier age.
With us being in South Africa, you don't have an NHS system.
Yeah.
So unless you have private medical aid, people generally don't go to the doctors, so they can live with stuff like that for years without it being diagnosed.
We need to have the paediatricians have a proper look at it over the next day or so.
Is she going to be admitted?
Yeah, certainly for
Okay.
today, and we'll see what the blood tests that we've taken show upstairs and see if they point us in anything that we need to do anything about in the short term. And we'll also have a look at things like diabetes and other sort of metabolic problems that people can have. Fabulous. Let me go make some phone calls and we'll get you taken upstairs. All right? Cheers, guys. Nice to meet you, and I'll see you.
Thanks very much. Thank you.
Nurse Kate is taking another blood sample to see if Era's blood sugar has improved.
Can I borrow your finger? And we're going to do that stamp. Stamp, stamp. Are we ready? Oh, hold on. Clever girl. Thanks. You are bleeding. Let's clean it up. Fantastic. Is that magic? That's it. Oh, all gone.
Era's blood sugars are now 5 times what they were earlier.
Lovely. It's gone up, yeah. It's much better now. Do you want a plaster?
I don't need a plaster. There's a little bite there.
Ew! It could be a virus that caused the vomiting, and then the vomiting that caused the low blood sugar, and the low blood sugar that caused the shaking.
While they wait for a bed, play leader Lindsay keeps the girls occupied.
Are you getting me? Does that mean you're feeling a lot better? Yeah, you look a lot better.
We're gonna go upstairs now. We're gonna go up to a different place. Is that okay?
On the ward, Era's blood sugars continued to improve. Diabetes was ruled out, and she was soon well enough to go home.
Oh, thank you very much.
In the hub, Nurse Kelly Stones is showing off her new baby for the first time.
How heavy is she? She was 8'3", but she's 7 something now. Yeah.
Let us see her hair.
Let's just
Look at her hair.
let's just disturb you just for our amusement. Well, right over here. We come in, she's joined us.
In one of the cubicles, Ian, who's had a bad migraine for 3 weeks, has just returned from his CT scan. While he and his girlfriend Colleen wait for the results, Nurse Chantel checks the images.
It looks like a meningitis or a bleed. I'd say meningitis.
Ian's blood tests also indicate he has meningitis. But the good news is, it appears to be viral rather than bacterial meningitis, which is more dangerous.
Once you've got all the information in front of you, you're a bit of a detective. You've got the patient's history, you've got their examination and the blood test results, and you put that all together to come up with the diagnosis. We're thinking you've probably got a viral meningitis again. All right, but obviously we can't rule out a bleed. The CT scans come back okay, but we can't rule it out. I'm going to give you some pain relief, some morphine. I've got an anti-sickness. I'm going to prescribe you, it's an antiviral medication as well. Okay, just to protect you. Are you happy with that plan? Okay. I'm going now. See you later, good luck. Okay, you're all right.
After a course of powerful antibiotics, Ian made a full recovery. He was discharged 6 days later.
How are we doing with the beds?
Because Sister Jane's struggling to get poorly patients transferred to wards, waiting times in Casualty are increasing.
Right, I've got a lady who needs a bed because she's had morphine, tramadol and paracetamol for her abdo pain. So obviously I put her to SA, but there's no beds on SA. I thought if I could get rid of one. Right. Okay, I'll keep her. All right, darling. All right then. Cheers, bye.
Right.
Oh, I can't.
In Rhesus, 84-year-old Terry's badly broken ankle has been straightened and the plaster has set. But Terry and his wife Lydia are going to be here quite some time yet.
Just gonna take some bloods if that's all right.
Oh, I've got some left, you can have some.
Yeah.
Dr. Trimble's coordinating his care.
Met my wife in a nightclub. So, she was a waitress.
Whereabouts?
Here in Barnsley.
Oh yeah.
There was a good nightclub here called the Bar Club. When I went in on my break, I knew that she liked me because when I had a cheese sandwich, she always gave me 2 pickled onions. We've been married 40 years.
Oh.
Next year.
Are you going to do something nice for your 40th then? Have you got something planned?
Might go for a dance.
Oh.
I'd like to have a dance with my dear wife.
Yeah.
Terry's dancing days might be over.
We'll go round for x-ray, okay?
Right, sweetheart.
I've said to the orthopedic doctors about you as well.
When an ankle breaks this badly, the knee can fracture too.
Find any patients again?
Casualty is at full capacity, and nurse Chantel needs a cubicle for her latest patient.
I'm just trying to find a trolley in a room. Finding a cubicle. Oh my, it's a nightmare. I'm gonna use this room. You feel so rude asking someone to come out, but you can't examine someone in a corridor. It's a nightmare.
Now she needs to get her patient into the room before someone else nabs it.
Are you in pain? Is that why? People do have different pain thresholds. I don't have one at all. I am the biggest wuss when it comes to pain.
58-year-old Dawn has been in agony for over an hour. She severely injured her back while bending over to pick up one of her baby granddaughter's bottles.
Okay. That's it, shuffle your bum in. Well done. Right, so start from the beginning. What brings you here today?
Just bent over and
Yeah.
it just went. And I ended up on the floor and I've been able to hardly move since then.
Any pains going down into your legs?
Yes. Nips.
Both
And
sides?
Both sides.
Into your bottom?
Yeah.
Where does the pain go down?
Mostly into my hip. This
Yeah.
one's worse.
Okay, on your left-hand
On
side?
the left-hand side,
Okay.
yeah. And it's down to about here.
Okay. Right, this leg, lift it up for me.
No, you're joking.
Come on. Is it due to pain or that you just can't do it?
I can't lift it up. Please.
Is it a weakness or is it due to the pain?
It's both.
Both. Okay. This one? Would you have been able to do that before this has happened?
Yeah.
Right, lift it up and hold it there. You feel like what? Can you not hold it there at all? Do you get pain in your back?
Yeah.
Okay. And the same with this one?
That's worse.
You can't hold it there?
No.
Right, okay. Can I take these slippers off?
Yeah, sure.
Thank you.
That made it stinky.
I smelt worse, I bet.
Bet you haven't.
Right, lift this leg up for me. Okay. I want you to push against my hand. Push, push, push. No? You need to try and rule out something called cauda equina. It's just a compression of your nerve root. It is an emergency if you have it, and then we have to deal with it then, but we need to rule it out. We can't rule it out without an MRI. And you don't want to damage your nerves, do you?
Compression of the spinal cord can lead to paralysis. If Dawn's MRI indicates there is a problem, she'll be rushed into theatre.
I can't take him yet because I need his insulin.
Barnsley Casualty's cubicles are jam-packed, so Sister Jane is trying to transfer the most critical patients up to the wards.
Joe, we have no beds, surgical-wise, in the whole hospital, and I've got 47 patients in the department at the minute.
It isn't good, is it?
No.
One of Jane's patients who might need a surgical bed is 58-year-old Dawn. She's about to have an MRI scan on her painful back.
Do you want us to help you? Just let us know what you want us to do. I'm down. You can just bring your shoulders just this way a little bit.
Doctors are concerned the nerves in Dawn's spinal cord are being compressed.
So the whole thing should take about 15 minutes. If you're more on one side than the other, have a shuffle and find it all. Nearly there.
If the images show Dawn's spinal cord is in danger, she will need emergency surgery. In resus, Dr. Trimble is waiting for her 84-year-old patient Terry to come back from having his badly broken ankle x-rayed.
I was stood at the kitchen sink and I turned to go away from it and my left ankle give way.
Oh dear.
And I went down and I heard a snap and I broke my leg.
Dear.
Simple as that.
Oh dear.
That's your x-ray there.
Oh my God.
You can see the big crack down here. And a big split through there as well. That was the bit that was poking out the skin. Then the other bone, which is your fibula, that's fractured as well.
So 2 fractures.
Yeah, 2 fractures. It's obviously from the joint line, you can see it's very unstable.
Dr. Trimble calls in junior Dr. Nick Sinanen from orthopedics.
Hi, sir.
How are you doing?
Very nice to meet you.
And you?
My name's Nick. So you've got something called an open fracture. I'm going to speak to my boss, but potentially you might have to go over to Sheffield.
All right.
And they're probably better equipped to deal with it than we are. Okay?
All right.
There is.
Sheffield is 23 miles away.
You okay? Sure.
She's not.
No. But listen, everything's going to be okay. All right.
She's straight about my mind. I think I can't drive out of the way.
Listen, if you need to get over, I'm sure that they'll let you get in ambulance with him and transfer across over with them.
Yeah.
And if you've got family, then they can fetch you back.
Yeah.
Okay. Don't worry about things like that. I'll get you a cup of tea and drink.
All right then.
All right.
So I spoke to the orthopedic consultant at the other end of the phone.
Consultant Dr. John Rayner has spoken to a colleague in Sheffield.
She's keen to see you tonight, and if you need an operation, she'd like you to have that in the morning. So what we're going to do is move you to our little ward, CDU. When they ring us to say that you've got a bed over there, we'll send you over in an ambulance.
Thank you, Barnsley Hospital.
That's all right. No problem.
Thank you very much.
Okay.
Don't know when you'll be going because we're waiting for transport. That's just been booked, okay, so it can take up to 4 hours. All right.
Lydia was able to go in the ambulance with Terry to Sheffield. He did need surgery the next day. It went well, and he's now recovering at home. Over in Pediatrics,
I'm going to put them in house. Haven't they got bed?
Nurse Kate helps play leader Lindsay tidy up.
At least we've still got Donald and Daisy together. Mickey feels like he's lost his other half. Am I popping this?
Go on, do it.
I did!
Go on, do it.
No, I did!
Go on. No, Dick, notice.
Oh, that were quite scary.
Dawn is about to get the results of the MRI scan on her back from consultant Dr. Claire Guinness.
So your MRI has been looked at by the specialists. There's a bit of disc bulging, which is where the soft tissue in between the bones of your spine, the disc there, is bulging a little bit at all the levels down in your lower back, but not so much that it's causing you mischief with the nerve down the middle of your spine. So that's good news. You don't have the dangerous type of squeezing on your spinal cord that we were worried about.
Just glad it's not majorly dangerous, because these operations are not good, are they, on backs?
Well, it depends, you know, some people need them, and if it saves you a lot of trouble down the line, then it's worth it. But you're right, it's a big deal to have surgery on your back, absolutely.
It is, yeah. All right, darling.
OK, love.
Thank you.
All right.
Dawn's back pain slowly improved. After a 2-night stay, she was able to walk out of hospital. The shift draws to a close, and Sister Jane and Sister Vicky have transferred all the critical patients to the wards.
He's gone. Just waiting for him to pull bed for that one. That one's going home. Waiting for bed to be pulled for that one. And that one's gone as well. Alan just needs to code, and then we're on top of it.
They've freed up most of the casualty cubicles, so the night shift can get off to a smooth start.
We work together and we cry together, and that's the nature of the job. And if that involves a cuddle, then that's how it is.
I love you.
I love you.